pillars as far as tackling this disease is concerned. So in terms of ramping up testing, if you look at this slide, India has significantly ramped up its testing in the last 3 months. In January, we just had one lab, that is the Indian Council of Medical Research National Institute of Virology at Pune, which was testing or capable of testing for this virus. Subsequently, we gradually ramped up, and also we had a very intelligent and a calibrated testing strategy which was responsible for testing the right people, not over testing, not under testing, and just getting the right calibrated results. So 28th February we had 14 public labs. 31st of March we had 125 public labs and 52 private labs. And today as we speak we have about 612 labs, out of which 480 are public labs and 182 are private labs. And we also have the TrueNat and the CBNat etc. being used for testing. We have also increased. Initially in the month of February we were just screening and testing travelers who returned. Now we are testing travelers, healthcare workers and frontline workers who are symptomatic, SARI patients who are symptomatic, ILI patients symptomatic. We have also adding clusters, women in labor, symptomatic ILI among returnees, and hospitalized ILI patients, and also contacts. So now we have ramped up testing immensely in the last 3 months, and we are testing about 1.1 lakh samples in a day. As I mentioned, we have about 612 total labs, out of which 430 are public labs and 182 private labs. And the capacity of these labs has also been increased by augmenting, one, by the number of labs, and two, by the shifts. People are doing 2 to 3 shifts a day and testing in 8-hour shifts, and also increasing and augmenting the number of RT-PCR machines and also the manpower. Guidelines have been issued to states advising immediate testing for symptomatic and home quarantine for asymptomatic. And most states who have been working with the National Tuberculosis Elimination Program have now deployed the TrueNat machine.